Hi, my name is Dr. Beanland. I'm the senior partner at New England Oral Maxillofacial Surgery.
For every single child, we set up anything for an emergency. So we have an LMA, an endotracheal tube, an oral airway, and any medications to help with anything emergent that would arise.
What I'm doing now is I'm just prepping the computer for our pediatric case. So we're gonna get a note going first. It just briefly goes through pain, temperature, any changes to medical history, any new medications or allergies. And then I'm also going to be making an anesthesia note, and that's going to chart how long the patient has been sedated for, kind of go through all the times, like the time they entered the room, the time that we start the surgery.
Staff brings an enormous amount of positive energy to the practice. Even if I were having a down day, the staff overcomes that with their positive energy. It's like the F1 team where we do a dance. Everyone knows how to do the dance. We don't even have to speak. All eyes are on the patient and the airway, IV, vitals. The procedure itself, as you all know, is incredibly easy. It takes about a minute in most cases. The preparation, the execution of the anesthetic, and the wake-up is the most critical piece here. The procedure is done. The wake-up, like landing an airplane, can be full of excitement with laryngospasm, cardiac changes, so forth. So you're not done until the child's awake and crying. When a child can walk to recovery, I don't worry about them as much because they walked in. If we carry a child into recovery, then we probably need to put them in monitors. Got to really keep an eye on them. The primary focus of my practice is the level of anesthesia we provide. It is hospital level general anesthesia, which allows us to treat the enormous numbers of pediatric patients that we treat. It also allows us to manage the severely anxious, needle phobic teenager quite easily. The next child's 6 years old. She's in pain. The airway may be a little more challenging. The IV might be challenging. We anticipate all of that, but we get it done with mom's help. I don't do anything without a parent helping. We don't hold a child without the parent holding the child.
This was a little bit more anxious than normal pediatric patient. We're not managing just one anxious kid, but you're also managing the parent who's also very anxious too. So I think that's one of the challenging things about doing these anxious pediatric patients. But I think that's where we try to excel and then try to comfort the parent, which will also help comfort the kid as well.
So here we're just waiting for the patient to emerge from the anesthesia and wake up, as you see in your practice every day. Great thing here is we have staff that are so experienced. I can sit over here and do my notes or just relax. So we're just waiting. Patient's starting to move a little bit. Having staff, as I do, that are so experienced. Part of that is because we've been treating children for about 15 years, hundreds every year, sometimes over 1,000. So parents see it. Parents comment on how exemplary the staff were and are, and they connect with the parents. If a parent expressed the typical expected anxiety bringing your child to an oral surgeon, I would tell them that we got this. It's what we do. We're focused on anesthesia on children. We recognize that the child and the mother are one unit. We will take great care of their child, and we will do it with the least amount of intervention, least amount of risk, and in the end, just make sure they do well.